Hello, my name is Candace Barnwell, and welcome to this presentation. I'm doing my project on allergies and asthma. According to Heather and McCain, allergies and asthma go hand in hand. Asthma is a disease of the windpipe branches, while allergy is an immune system that is responsible for a foreign substance that is not typically in the body. There exist different types of asthma, including allergic asthma, which is triggered by an allergy. According to AAAI, most of the 25 million asthmatic patients have allergies. During an asthma attack, the bands of the muscle surrounding the airways mostly tighten, hence causing them to narrow further. Additionally, the lining of the airway becomes more swollen. An asthmatic attack also causes the cells that line the airway to produce more mucus. Signs and symptoms of allergic asthma are the same as those of non-allergic asthma. An individual with allergic asthma is likely to start coughing, wheezing, followed by shortness of breath. Some patients may fail to experience shortness of breath, but experience fast breathing, which is also a sign of allergic asthma. Some patients may also experience tightening of their chest. All these signs and symptoms vary from one patient to another. Allergens that an individual inhales are said to worsen allergic asthma widely. There are different allergens, both pollen from trees, including ragweed, mold, animal dander, saliva, dust mites, and cockroaches. Worsen allergic asthma. If one touches or eats these allergens, they are likely to get allergic reactions, especially those at a greater risk. Although sometimes such exposure may fail to produce the signs and symptoms of asthma, they can cause some life-threatening reactions, including anaphylactic shock, which in the long run makes an individual unable to breathe. The types of allergens that affect a patient are sometimes determined at the healthcare facility when the doctor recommends some allergy tests. Although irritants do not cause allergic reactions, they can sometimes trigger an asthmatic attack. Some of the irritants that can trigger asthmatic attacks include cold air, air pollution, tobacco smoke, intense emotions, strong chemicals, and perfumes or other scented products. Individuals are advised to avoid some of these irritants, especially if they have a family history of asthma. Individuals that work in different chemical industries are advised to use the appropriate personal protective gear to avoid the odors that can cause asthmatic attacks. Individuals are also advised to avoid being too emotional to avoid asthma attacks. Individuals living close to places that are polluted are also said sometimes to get asthma attacks. There are various risk factors associated with allergic asthma that individuals need to be more careful with. Allergic asthma is sometimes said to be a family disease. According to Malby et al., a child whose parents are asthmatic is 3 to 6 times more likely to develop asthma as compared to those whose parents do not have asthma. Individuals, irrespective of their age or social status who are overweight are at greater risk of getting allergic asthma. Low-grade inflammation in the body is said to occur with extra weight. Cigarette smoke is said to irritate the airways, hence increasing the risk of allergic asthma. Exposure to certain elements, including wood dust or some chemicals in the workplace, increases the risk of allergic asthma. Wheezing can arise due to respiratory problems during childhood and infancy, hence later developing chronic asthma. There are a number of tests that can be used to diagnose allergic asthma. The doctors first investigate the medical history of the patient. They check the symptoms and do a physical exam. Next, a doctor can do several other tests to help check the condition of the chest. According to Paxley et al., a chest x-ray is carried out to help visually check the chest condition. A picture of the lungs is usually taken, then closely examined by the doctors. Muir recommends the methylcholine challenge test, which is used in checking if the airways are sensitive to methylcholine. Methylcholine is an irritant that is said to tighten the airways, hence resulting in allergic asthma. According to Tiscali et al., peak expiratory flow test is recommended for patients with asthma symptoms. The test usually measures the maximum speed that the air can be exhaled from the lungs. The patient is requested to blow into a handheld device that is known as a peak flow meter. Pulmonary function test is also recommended by other doctors. The test usually measures how well the lungs can take in air and how well the lungs can be exhaled. The test is carried out by the patient blowing a tube placed between the lips. Apart from avoiding asthmatic triggers and carefully monitoring of asthma conditions, there are some drugs that health care providers is likely to prescribe. Since allergic asthma causes some muscles to tighten around the airways, bronchodilators should be taken to relax these muscle bands. The drugs rapidly open the airways, hence allowing more air in and out of the lungs, hence in the long run, improving patients' breathing. McCracken et al. States that bronchodilators also help in clearing mucus from the lungs, since mucus is able to move more freely as the airways are open, hence making it simple for the patient to cough the mucus out. The anti-inflammatory drugs, including Asthmax and others, help in the reduction of swelling and mucus production in the airways, making the airway less sensitive to react to triggers. The leukotriene modifiers used for allergic asthma treatment include Singulair, Zyflo. The airway muscles are likely to tighten due to leukotrienes. Therefore, modifiers are necessary to help in limiting these reactions and improving airflow in the lungs. Omnalumab, on the other hand, helps prevent allergens from triggering an asthma attack. The drug is given as an injection to patients with known allergies. There are various ways that an individual can avoid allergic asthma triggers that patients need to be taught about to help protect themselves and others within the community from allergic triggers. Individuals are advised to stay indoors, keep their windows closed, and even use air conditioners to filter air when the levels of pollen counts are high. It is also essential for individuals to wash their sheets regularly with hot water and cover their mattresses, pillows, and box springs with allergen-proof covers to help keep dust mites out. Houses with individuals who have allergic asthma should not have items where dust can gather, especially the wall-to-wall carpets. Patients should ensure that they get rid of molds if moisture is a problem for their houses. Individuals who are at greatest risk should always remain careful when working outside to avoid stirring up mold and pollen, especially when gardening. There are several things that a patient can do to help control allergic asthma. First, the patient needs to strictly follow the treatment plan to help ensure that they live free of symptoms. Additionally, close monitoring of the functionality of the lungs is necessary. This can be achieved using the peak flow meter that measures the speed of air that comes out of the lungs after forceful exhaling. The meter helps in alerting the patient of any changes in the airway, hence being able to change the medications. For more information on asthma and allergies, kindly consult the following resources. Thank you very much for listening to my presentation.